everyone and welcome back to my YouTube channel Preciously Healthy. If you are new here, hi and welcome to my channel. I am Sharon and I make YouTube videos on my channel, everything and anything related to nursing that every other nursing student or every other working nurse needs to hear. So let's get into the video. Today's video is all about different types of nursing or medical apps that you guys can use and can be handy if you are a student or if you are working. So you and I are going to review and check out some really amazing apps which I have picked through some suggestions or maybe randomly. So let's see if it is really handy for us to use or no. But when I was a student in my 4th grade, I used to use this one app, that is ObGyn. So first off, we have my very favorite app, that is ObGyn. And this app is a very handy app if you are studying obstetrics and gynecology. So I have seen when I was a student, me and my classmates used to have this a very irritating time that we have to search and we have to calculate the estimated due date or let's say estimated delivery date by also calculating their menstrual date, last menstrual date, then conception date. It goes a haywire when we actually calculate it all. So this app is the exact and the loveliest app that you can have, because here you only need to put the LMP and the conception date and it will give you the end of first trimester, second, and also the estimated date. Next up, we have this other amazing app which I am really sad that I didn't know, but you guys are really lucky to know it about, because this app is known for nursing diagnosis list. I mean, where were you till now? I am well aware that when we are studying in our nursing school, this is the biggest and the most irritating thing that every nursing student goes under when your teachers pressurizes you to list down the priority nursing diagnosis or different type of nursing diagnosis. Even sometimes in community health nursing, we used to have to list almost 10 of them, and we are so much confused and our fray is so much going on in that situation, because we don't know other than like fever and acute pain and knowledge deficit. So this app is really handy because this app has a lot of other types of diagnosis list, starting from ineffective airway clearance, chronic pain, acute pain, impaired tissue integrity, and lot more. Also, they also have a section for search, so you can just put up the section that you want to search and you just have the list. Isn't that pretty? So this app is really amazing because it is also free to use and you can actually go through all of them. So let's click on some random and let's see if it is really that. Okay, so the one which I have clicked is impaired swallowing. So they are giving the definition of it and also a little description about it, also the related factors, nice, and the mechanical factors. They have also given the characteristics and the goal and outcomes. Wow. And the nursing assessment, of course. The rationales and the assessments is the exact way how it is given in the Nanda's diagnosis. So this app is a very much yes from my side, and I will really recommend this to all the students out there. So in the recent days, I came across this really very nice app through some of my friends known for Karyonz. So this app is a very nice platform for all the students who are preparing for NEET, JEE and all the other competitive exams, because this app is all run by the students all over in India. So you can actually share your notes, you can ask questions, and you can also sell the notes if you got the opportunity. You have 3 categories in this app, which is one for professional, one is for the students, and one is for the business. So if you are going through the students section, you will get a lot of different type of tutors and other students who can help. So here is this another app that is for again nursing diagnosis and care plan. So this app has literally 1000 and plus nursing care plans and 50 and plus nursing diagnosis. So you don't have to worry about how many kind of diagnoses you have to enlist and then how many other rationales and assessments you have to write, because this app got your back really hard, because this app has literally 5 care plans for all other types of disease condition, right from alcohol withdrawal to benign febrile convulsions. So this is really amazing. So let us click on someone and let's just check. On the care plan in the form of the same way that is in the other app. So this is also an app that I can suggest, but this has a little less description and nursing assessment, interventions and rationale that is given, but this can be handy if it is like a very go-to situation and you have to tell in a very immediate situation that this and that was the nursing intervention. So this app is really amazing, you can use it. Next up, we have this other amazing app that is really handy if you are working in the hospital, that is Nurses Guide to Clinical Procedures. I mean, I am well aware that every other nurse has some or the other difficulty performing some or the other procedures, or mostly the students in their starting days. So this app is really going to be handy and useful, and it will be a great help for you to understand different types of procedures or assessments that you can do. So let's check. So as you can see, it is a very precise app. They have literally all types of administrating and other aseptic techniques. So this is one of them, that is administrating eye. So they have given very precise equipments point to point. They have given assessment about it, the nursing diagnosis, also the outcome ID, and which is very beautiful, and most importantly the implementation rationale, which is being asked always in nursing when you do the procedure while your vivas and all. And then there is also this evaluation that you can tell. Next, moving on, we have the main index, where there is the first one, that is abbreviation. So they have given so many things, and there is abbreviations from A to Z that are used in the hospital, and mainly when you are working, the abbreviative language is the most language that is used in the hospital than the full term words. So this will really help you to understand and go through if any word that you don't understand, or the abbreviative language that you don't understand. Next is we have this display of the basic things that are we supposed to learn, that is barriers of therapeutic communication. This will help in the viva. Next is the body positioning and other types of basic things that are asked. So the first one is the body position, where they have given the positions, its rationale and purposes, and the description. That is very nice. This is the most amazing part of this app, that they have given the drugs from A to Z that are used, and which is the most difficult part when you are studying your pharmacology. So this app will definitely help you in learning your pharmac, and very helpful for other purposes too. The most important part of this is that they also give a very precise new information that is published everywhere, or if there is any new update, the app publishes it on their app, and you will be up to date for all the time you are using this app, which is a very beautiful thing and a very must thing for a nurse to know, to be an up-to-date one. So this app really gives you literally the complete nursing procedure, step to step, with all the aseptic techniques and the articles that are needed. So this app is really going to be handy if you are preparing for your vivas or any other interviews too. if you have to perform your nursing procedure. Next up, we have this other app known for nursing notes. Now this app is handy and very beneficial for all the nursing students who are doing their GMM, PPBSc, BSc nursing and other paramedics too, because this app has variety of options where there is one option for nursing notes, and this app gives you different notes that you can keep in mind for your vivas. Like for fundamental nursing, they have option for maternal and child nursing, medical and surgical nursing, psychiatric. I mean, right from your first year to your fourth year, literally they covered all the topics and subjects. So you have all the notes that you need, just like in brief or just for the vivas that you can keep in mind, or like to outsmart somebody, you can keep the notes in this app. The notes are so much made for you guys, and you should definitely refer this app, and do not forget to subscribe my channel for more videos too. And this has a very precise information about the definition, diagnosis and more other topics too, so it covers literally everything. Next up, they have this other option that is for the clinical nursing care plans, and just like the other apps, they have given notes on the care plans that you can keep in mind and use while you are writing your assignments maybe. So this app is also another very amazing app. Oh my god, they also have this option of YouTube, so you can just click on that YouTube option and that will literally take you straight to the topic that you are searching for. You also have other apps recommendation in this app, that if you don't have to find some topics that are relevant in this app, you can just go to the other apps too. They give latest news regarding nursing opportunities too, and they also share different types of apps in this app. So you can really use this app, because now I am going to use this app for a long time. Big khushkhabri for all those freshly grad nursing students who are working there in the hospital as a fresher. This app is really going to be handy if you are working in a med-surg department, because this app is known as NursesBrain. This app is like, it will give you situations and you have to give the situation of your patient. You can enter the patient's name, age, room number, the sex of the patient and the full code, that is the vitals. Then you can also write the medical diagnosis, that is diagnosed by the doctor, race, culture, disability if the patient has it, visitation concerns and support system, and lot more. And this situation is going to give you all the things that you need and you can keep in mind, because if you are handling a lot of patients out there, you really get confused for the medications. And if you have this situation going on with you, if you get really confused to what to do, when to do, this app is really going to help you, because it will not only give you suggestions about the assessment, background of the patient, recommendations, significant events and lot more, and it will also give you different kinds of alerts when you need it. So you can keep the patient's info on the tip of your mouth, and anytime anybody can ask you, you can just tell them like a very professional nurse. So this is a nice app that I can suggest. Here, as you can see, that I'm putting up all the details of the patient randomly. So we just have to put whatever doctor name is or the consulting doctor is. We can also select the type of precautions if it is needed for the patient, the type of management that is being told to us, the alerts like sugar taking or other vitals to be monitored. We can also put up the assessments that we are doing along with the other doctors or fellow colleagues. That's all for today's video. I hope these apps are really going to help you in your clinicals and in your studies, because I am going to use them with me for a longer time now, because every other app is really free to use. You don't have to pay for them, and you don't have to wait for the network because these also work offline. So I am going to use this for a very long time, and this is a very nice apps that I came across. And please don't forget to subscribe my channel, and I want to thank all those viewers who have given me 3000 plus views on my channel. And I would like to request to all of those people who are just viewing and going, please don't do that. Subscribe to my channel and also give me suggestions for whatever videos you want to see. And do not forget to watch my next video, because there I am going to burst different kinds of myths that people are having about nursing. So let's see you next time. Bye bye.